Good day and welcome to our point in time count training for Lancaster County. My name is Emily Price and I am the Latch Coordinator for United Way of Lancaster as well as the Pit Count Coordinator for our county. Today we'll discuss several topics surrounding the National Point in Time Count. This is our county's opportunity to ensure everyone is counted. Today we're going to define the pit count as described by HUD. We will discuss why we complete a pit count and who is actually counted. We'll provide volunteer information along with details on how we conduct the pit count. You will be provided with interview tips, and finally, we'll go over the actual pit count survey and discuss next steps. Now, let's take a look at the big picture. During the pit count, we are tasked with counting everyone in our community who is experiencing homelessness. We want to understand the total number of homeless people and some demographic information about them. Because all of this information is collected on a single night, typically within the last 10 days of January, it doesn't tell us everything about everyone who ever experiences homelessness in our region, but it does give us a small picture or a snapshot of this part of our community. It offers a means of comparing what we learn on a single night, year after year, and it also gives us some data required by the U.S. Department of Housing and Urban Development, or HUD. And some of it is information that we as a community want to know to help us understand how well we are serving the people. And it'll also help us know how we can best plan to use our resources. Here are a few localized reasons as to why we do a pit count. Increased understanding. Data collected during the pit count helps us to understand what homelessness looks like in our community. Increased funding. Data collected during the pit count helps us to advocate for increased funding to address homelessness. Improved programming. Data collected during the pit count helps us to tailor our services to meet the needs of individuals and families experiencing homelessness. And lastly, community representation. Data collected during the pit count helps us to represent our fellow community members who are experiencing homelessness. Now let's talk about who is counted in the pit count. When we think of homelessness or the lack of stable housing, we think of it in terms of two pit counts, the sheltered pit count and one for the unsheltered. HUD only counts people who are considered unsheltered. That includes those sleeping in places like those listed on the right side of the screen: cars, parks, abandoned buildings, and street corners. In Lancaster County, we also count those at risk of being homeless, like those who are housed by churches, emergency shelters like our warming center, hotels paid by vouchers, couch surfing, or living pillar to post, and those who are incarcerated or in transitional housing. All volunteers will need to receive training and sign the appropriate waivers. On the day of the count, volunteers will be paired and assigned specific locations throughout Lancaster County to complete their surveys. This will include a street outreach team. They'll travel throughout Lancaster County to complete the surveys. Organizations will complete surveys for individuals that have been identified as unsheltered and sheltered. And we'll also ask for a few data entry specialists to assist us in ensuring all of the surveys are entered into Cognito. Volunteers will be equipped with volunteer kits that include surveys, clipboards, pens, pencils, flashlights, incentive packs, brochures, and a list of emergency contacts. We ask that all volunteers remember the following. Please don't bring a purse, or at least don't bring a large purse. No large jewelry and no heavy perfume. We ask that you prepare for the weather, layer your clothing with pockets and comfortable shoes. Make sure you have an ID on your person and that you charge your cell phone, as this is what we'll be using for our surveys. Save emergency numbers in your phone and use the buddy system at all times. Please do not wander off alone and ensure that someone knows where you are. Ensure to place the provided pit count signs in the dash of your car to ensure police or any others are aware of why you're in their community. If counting at night, ensure to have a flashlight. And lastly, always call 911 if you are or someone else is at risk of danger. Now let's move on to how to conduct an interview. Step 1. Approach and introduction. Approach the person and introduce yourself. Ask if the person has a few minutes to answer some questions. Step 2. Explain process and get consent. Explain why you're there. Explain that individuals who complete the survey will be given an incentive item. That's our care kits. If they consent to answering your questions, continue with the interview. If they don't, thank them for their time and document what you observed. Use the observation form in your volunteer kit. Now let's move into step 3, conducting the actual interview. Go through each question in the survey form. Remember, people have the right not to answer all the questions. Add any notes that may be helpful. For example, if a person says that they have their own apartment, but they're sitting on a bench outside of a 24-hour grocery store with what appears to be all of their belongings, write that down on the documentation observation form. Step 4, closing the interview. Ensure to thank the person for their time, refer them to any services or resources they may need or have asked about during the interview. Also, ensure to provide them with an incentive pack. It will have resource guides and other information about local resources. Now we're at our last step, step 5, recording what you heard and observed. Take a few minutes after your conversation to double check that you've completed the whole survey form. Keep in mind, if you don't complete each part of the survey form, you will be prompted to go back to those sections. Include any additional notes or details and make sure everything you have written is legible if you are using a paper survey. Also, if you're using a paper survey, please make sure to print so that we can read it at a later time. Now, let's take a look at a few interview tips that will help you along the way. Number 1, lead with respect and dignity. Remember that you are speaking to highly vulnerable people and asking some very sensitive questions. Always lead with respect and dignity. Maintain eye contact if possible. Keep an open stance with your hands visible. Use a tone of voice that's approachable. Speak slowly, be polite, and don't shout. Remember the goal of the pit count. The ultimate goal is to count the number of individuals experiencing homelessness. No data is better than bad data. If a person is visibly upset or angry, irritated, or giving silly or fake answers, please end the interview by saying, "That is all the information we're looking for today." Don't put yourself at risk. Read the entire question. Ask all questions unless the person has already given the answer to the question over the course of your conversation. Remind participants of choice and confidentiality. Everyone has the right to refuse to answer any or all of your questions. If a respondent is unsure or upset about a question, remind them that their answers are confidential, but don't push too hard. Let them know that they can skip that question if needed. Don't define terms and never suggest answers. Always ask questions as they are written. If a respondent asks for clarification on how to interpret the question, don't define terms. Let the respondent know that however they interpret the question is correct. For example, if you ask a question, "What is your sex?" Don't say, "You're a female, right?" Use neutral transitions. Repeat the answer back to the respondent or use a neutral transition such as "got it" or "next question" rather than saying "good" or "right." Avoid affirming or responding to answers in the positive because it makes the respondent think that you are making a value judgment about their answers. You always want to avoid apologizing or commenting on answers relating to homelessness or to their struggle. At the end of the survey, you may want to say something like, "I'm sorry you're experiencing this hard time," but you don't say that during the interview. And here's our last tip. Never wake the sleeping. Individuals sleeping outside may be dealing with active addiction, mental health concerns, and significant trauma histories. Do not sneak up on or startle people, and never shine your flashlight in someone's face. The QR code below will allow you access to this year's survey specific to Lancaster County. On the next slide, you will watch a video provided by Melissa Carlisle of CASH, the Catawba Area Coalition for the Homeless, walking you through exactly how to complete the survey.
We do make every single field in question required. So even if the person chooses to not answer it or it doesn't apply to them, you still have to put something in every single box. And that's just to make sure that you guys don't accidentally skip over a question. So I get that it may be annoying, but there is a reason for it. So the very first page is just going to be your information. So this is really helpful if we're going through the surveys on the back end, we're compiling data, and maybe something's missing or we have a question about something. This just lets us know who the surveyor was, so we can go back to you and ask you if we have a question about a particular survey you did. Now for the survey location section, this is all the different stations we know that we'll have during the pit count and where we know pit count surveys will be taking place. So for folks on the street outreach team, you would just select street outreach team. Ms. Devonda with Pilgrims Inn, if you and your staff are completing surveys on site, you would just select your location. Bus Hub is going to be another big one where we're going to have a lot of surveys completed. So you would just select the appropriate one based off of where you're at. And this just helps us in the future know where we got a lot of survey responses and maybe where we didn't get as many survey responses so that we can plan for where to station volunteers accordingly in the future. County of current location is always going to populate as York. However, if you happen to be in Chester or Lancaster, maybe you're helping out with their pit count efforts, you accidentally pulled up our survey link, that is totally okay. You can always say other and then type the county that you're in, and we can send that county these pit count results. And then date of survey is automatically going to be whatever the date is on the day that you're completing it. Okay, so this is the spiel that I was talking about. So this is what we have to read aloud to every single person, word for word, before we can continue on with the survey. This is how we get consent. It does automatically fill in your name based off of that first page. So however you want to identify yourself to the person, just make sure that you fill that information in accordingly. If the person gives consent, you're going to just keep that yes selected and then hit the next button. If they say no, they don't give consent, you're going to get this note to stop the survey, thank them for their time, move on, and then to stop the survey, you can just refresh your screen and it's automatically going to take you back to that first page. But if they say yes, you're going to hit next and keep going. Okay, this question is really important. Where did you sleep last night? Or where did you sleep on the night of January 28th? So the majority of our volunteers are going to be conducting surveys on Thursday, January 29th. So that's why we have the comment about last night. But obviously, if you're conducting surveys on January 28th, you can say, where are you sleeping tonight? And then we have on here all the different options that people can select. So for most of these, you're going to continue on with the survey. However, if the person says that they stayed in their own house or apartment, you're going to get this note again to stop the survey. That is because this person is not experiencing homelessness. They're not at risk of homelessness if they're staying in their own house or apartment. So we don't need to go through the entire survey with them. Now, if someone says that they were at an emergency shelter or a transitional housing facility, it is going to ask you to type the name of that facility. So if they stayed at Bethel Shelters, you would type Bethel Shelters. And then, did another volunteer or survey worker already ask you these same questions about where you were staying tonight? So this is just to make sure that we're not having one person take the survey multiple times. So if someone says, yes, I've already been asked about where I was sleeping, I've already completed a survey, again, you're just going to want to stop the survey, refresh your screen, move on to the next person. Okay, so did anyone else stay with you on January 28th? So with this question, sometimes we have people respond yes, and they say, you know, I had 60, 70 people staying with me last night because they were staying in a shelter or in some sort of like congregate sleeping area. That's not really what we're looking for. What we're looking for is household information. That being said, we do not define a household for someone. So it doesn't have to be a blood relative or family member. It's really however they define their household is what we would then capture data for. So for example, many of our folks who are staying out at encampment sites, you know, may have been in an encampment with the same people for years and years and years, and they consider those people their household members, even though they're not blood relatives. And that is totally okay. That being said, we don't need to collect data on, you know, the dozens and dozens of people that someone at a shelter may have stayed with. So if the person says yes, that they did have other people staying with them, you're then going to ask, including themselves, how many adults and children were in their household. And you want to make sure that you get their ages too, because HUD is very specific in the way that they count different population groups. So this young adults group, this 18 to 24, HUD actually considers as youth. So that's why it's kind of broken out like this. So if the individual is over the age of 25 and they have someone staying with them that's 18 to 24, you would put 1 for adults over 25 and 1 for this young adults category. Now, remember, you have to put something in every single field. So even if there's no children staying there, you want to just make sure you put a 0. Any questions about that? All right. Okay, so now we get into the demographics section. So first off, how old are you? So you'll just record whatever the person says. What is your first name? What is your last name? What is your sex? And this question did change. So this used to be gender, and there used to be a bunch of options listed. But with the changes at the federal level, we now only have female, male, or does not know or prefers not to answer is options. So just something to keep in mind there. And then for race and ethnicity, you can select as many as apply. Obviously, some people identify with multiple different races and ethnicities. So just select as many as are applicable to that person. History of homelessness. So this is where we get into the person's actual experience of homelessness. Is this your first experience of homelessness? This is just yes, no. And please note, we have this doesn't know, prefers not to answer option for all of these multiple choice questions. How long have you been experiencing homelessness this time? So we know that many people have multiple episodes of homelessness. So HUD is really looking at, for this current episode of homelessness that this person is in, how long have they been in this episode? On what date did your current episode of homelessness begin? Now, this is going to be tricky. Most people are not going to know the exact date. Now, some people will, and they'll tell you month, date, and year. Some people may just be able to give you the year. Some people may just be able to give you month and year. So you'll enter as much information as you can. We do ask that you format it this way. So we want date, month, year. However, put an X whenever a date is missing. So again, if they know the month, but they don't know the day, you would just put 2 X's there. And then the year if they give you the year. Regardless of where you stayed last night or the night of January 28th, how many times have you been on the streets or in an emergency shelter in the past 3 years? And you'll just select whatever they say. And then total number of months you have been homeless, on the street, or in an emergency shelter in the past 3 years. And you'll just select whatever is appropriate. County of your last permanent address. So this, for most people, is going to be York County. We see a lot of people from Chester and Lancaster as well. However, if the person indicates that they came from an out-of-state county, please make sure that you put that state as well. So for example, we will see probably some people from Charlotte. So just make sure you put Charlotte, North Carolina, or Mecklenburg, North Carolina, if they give you the county name. Did an agency or organization arrange transportation for you to travel here from another county? This is a yes, no, or the person may say that they did not travel here from a different county. So you'll just select whatever's appropriate. If they say yes, it's then going to ask what agency or organization helped transport them here to this county. And you would just type whatever they say. If they don't provide you with an answer, you'll just put an X. Do you have any of the following disabling conditions? So for this question, again, you want to select all that apply, but you'll also want to make sure that you read these aloud to the individual. So you'll say, do you have any of the following disabling conditions? Do you have alcohol abuse? Do you have drug abuse? And if they say yes, you'll click along with them. Now, if they say yes to any of these, then of those disabilities identified, you need to ask which are expected to be long-term and substantially impact their ability to live independently. And you can always refer back up here so you know which ones to ask about. So you'd say, does your alcohol abuse, is it expected to be long-term and substantially impact your ability to live independently? If they say yes, you would select it. Have you ever been a victim or survivor of domestic violence, dating violence, sexual assault, sex trafficking, or stalking? This is yes, no. We do want to make sure that we ask this question the same exact way we ask all the questions, but keep in mind that the person may be there with the person that is abusing them. So if the person gets a little nervous, if the person asks to, step away, maybe take the survey a couple of feet, in a different direction, or ask for a little bit more privacy, just making sure we're being mindful of that and we're accommodating them to the best of our ability. Again, we will have cash pocket guides and resource guides in there. If you are able to safely do so and someone says that they have experienced domestic violence and that they're currently fleeing, just making sure that you open up that pocket guide and refer them to Safe Passage so they know where they can get assistance. If the person says yes to this question, it's then going to ask when that experience occurred and if they are currently fleeing. So again, just making sure that if you're able to safely do so, if that person is fleeing domestic violence, that you're referring them to Safe Passage at the end of the survey. Have you served in the United States Armed Forces? This is just a yes or no. Now, these next set of questions are actually questions that our agency has added because these are questions that oftentimes our community members are asking us and they want to know. So we are asking about employment status. If the person is employed either full-time or part-time, we're then going to ask what their current occupation is, and then you'll just type whatever they say. So I remember a couple of years ago, I surveyed someone who said that they were a nurse. So you would type nurse. You're then going to ask how long they've been employed at that current job. However, if they say they're a student, then there aren't going to be any more questions that pop up. If they are not working, if they're retired, or if they're disabled, you then are going to have this question that asks about fixed income. So do you currently receive regular income that stays about the same each month? We recently have seen a ton of people in our homeless response system that have reported being on a fixed income. So we're just looking to quantify this a little bit more. And then we're also going to ask those folks when was the last time they were employed? And then we're also going to ask the last question is which of the following situations contributed to you losing your housing or not having a stable place to stay? So better understanding those factors that are leading people into our homeless response system. So similar to the disabling conditions question, you're going to want to read each of these aloud and select all that apply. Any questions? Alrighty. So at the end of the survey for the individual, you're then going to thank them for their time, but you're also going to, for deduplication purposes, ask for their date of birth and the last four of their social security number. They can, again, say no to answering these questions, but we do try to capture this data just to make sure we're not counting the same person multiple times. So you guys are now going to get my date of birth. And then if I didn't want to give you my social security number, even though we're only looking for the last four, you could just put all X's in. Okay, now that was the end of the survey for that individual. However, remember that in the beginning, that person reported having household members who stayed with them on the night of January 28th. So up here, excuse me, we have a note about how many household members they reported. So just to remind you how many people they said were in their household. Because for every single person that was in their household, you're going to ask those same questions again, but for each of those household members. So if this was 2, you would then go through this household member information form 2 times. So you go all the way through this, ask those same exact questions all over again, but for their household members. And then at the bottom, you would also be able to add if they had additional household members. Any questions about that?
Do these questions change, like if it's a child? Because I imagine if they said like one of the household members is a kid, we wouldn't be asking all these questions about employment and they were in the military and all of that stuff.
It does not change, Joan. We're required to ask the same questions for every single person in the household, but typically what happens is the client is just going to start refusing. So you're either going to just put X for a lot of these fields, or you're going to say client doesn't know, prefers to not answer. If it's for a child, I will say we don't typically capture a ton of data for people under the age of 18. It does happen that some people are reporting on information for their children, but we know that a lot of these questions are not applicable to people under the age of 18. So that's where you're often going to be selecting that client doesn't know or prefers to not answer, or this none option. Or, I mean, for the armed forces, if it's a child under 18, it would be no. That's a good question, though. So I'm going to quickly go through this just so I can take y'all to this last page. All right, so once you go through that household information, the very last page y'all will see is just this interviewer notes section. Oftentimes y'all probably won't have anything to type here, but if there's anything you want us to know about this survey, or anything you want us to know about the individual you were surveying, you can type that here just to let us know what happened or if there's any additional information we need. But if not, you can leave it blank or put not applicable, and then you'll hit submit. And this is when you know you've officially completed the survey with the person. And then you'll be able to refresh your screen and do the next survey with the next person. Any questions?
Now that you've learned how to complete an interview, here are a few more PIT count do's and don'ts. Do get consent before asking a PIT count survey question. Do remember that you may be entering into someone's personal and private space, and you want to treat it with respect. Do have a conversation with the people you interview. While the questions may be clinical, once you've completed answering the questions, you can have a normal conversation. And do respect people's time. Now, don't take personal photos of or with the people you survey. Don't ask questions in a way that assumes you know the answer. Don't insert yourself into the person's story. Don't force people to answer questions they don't want to answer. And don't make promises to the people you encounter. The PIT count is an opportunity to complete a survey, and we don't want to promise individuals anything other than the resources we have available in our care kits. All right, guys, this concludes our 2026 PIT count training. Let's talk about what's next. Please make sure to scan the QR code to sign the required volunteer application and waiver. The volunteer sign-up details will be in the email you have received. It will provide dates and times on the Sign Up Genius. We encourage you to go ahead and sign up for what date and time works best for you. And then practice conducting the survey. Please scan the QR code to practice conducting the 2026 PIT Count survey. All responses submitted prior to January 28th will be deleted and will start afresh on the date of the 28th. We at United Way of Lancaster and the Lancaster Area Coalition for the Homeless want to thank you for your time today, and we thank you for your continued support. Let's get out there and make everyone count. Have a great day.